Hi, thank you for joining me for this presentation on our project, Confidence, Clinicians for Effective Vaccine Conversations for Youth and Adolescents. My name is Grace Ryan. I'm an assistant professor at UMass Chan Medical School, and I am leading this work and have been working with some of your colleagues to have your clinic participate in this project with really our goal of better supporting effective and positive conversations with parents of youth and adolescents and with adolescent patients around vaccination. So just briefly, our team at UMass Chan is led by myself and Dr. Stephanie Lemon and Dr. Milagros Rosal, who have contributed to this presentation and to our work. So just to give an overview of what I'm going to cover over the next 30 or so minutes, I'll provide some background information, give an overview of our approach for discussing vaccine hesitancy with parents, and briefly go over using principles of motivational interviewing to guide these conversations. I will share some short videos that we have made to sort of role play the approach that we are talking about, and then I'll give a brief overview of the supporting materials that you might be seeing around your clinic sort of in support of these efforts. So broadly, our goal is coming out of this to think more about recognizing hesitant versus resistant parents and tailoring approaches to your conversation with them around that, and understanding key principles for motivational interviewing and how to apply them to conversations about COVID-19 and influenza vaccination. And I'll note our focus for this project is our outcome focus is around COVID-19 and influenza, but we strongly believe that these strategies that we'll talk about for having conversations are appropriate for many other vaccines that you might be having difficulty talking to parents about. So just briefly, since we are focused on seasonal vaccines, we saw a peak in our respiratory illness season, and this is from the Massachusetts dashboard that shows data across the state, but we saw a peak as we do often in January, and we're starting to come down, but still seeing around 10+% of hospital visits due to, or ED visits rather, due to respiratory disease. So we're still seeing a lot of influenza, COVID, RSV activity. Unfortunately, we are also continuing to see very high levels of hesitancy around vaccination, particularly for parents of teenagers and younger children. In this graph on the top, we are still seeing that 36 to 40% of parents are saying that they will not get the new COVID vaccine for their child. But this is interesting considering that, close to half of parents are reporting that they are worried or somewhat worried about their child getting seriously sick from COVID or RSV or the flu. So while we're seeing high hesitancy, we are also seeing high fear or concerns from parents, which gives us sort of an interesting way to approach this. And we'll talk about addressing sort of this discrepancy later in the presentation. But just to give you an idea of where we're at, this is national data, so not representative of Massachusetts. Generally, we have slightly higher rates for vaccination than the rest of the country, and your clinic might have even higher rates than the state. But I'm guessing that you are still seeing somewhat widespread hesitancy, especially around the COVID-19 vaccine. This work has been informed by qualitative research that we conducted in Massachusetts right around sort of when the COVID-19 vaccine was being rolled out to parents, or to children ages 5 to 11 and 12 to 17. We conducted focus groups with parents and clinician interviews to sort of hear about what was going on, what was on people's minds. And from parents, what was emphasized again and again in these focus group discussions was that they wanted to hear from their pediatricians about the vaccine. And what they really wanted to hear was those pediatricians' own experiences with the vaccine. They wanted to hear sort of that more personal story rather than just the education and the facts about what the vaccine was and efficacy. It was really that personal touch. In clinician interviews, this was certainly echoed. We heard a lot of clinicians. We spoke to people in both central and western Massachusetts. And our participants echoed this importance of sharing more personal vaccine stories, as well as the importance of touching base at every visit and thinking about this is sort of a more long-term thing to address, and that potentially parents are not going to say, yes to vaccination the first time you bring it up, but it might take those multiple touch points. This research, our results are very much echoed in the national conversation around pediatric COVID-19 and influenza vaccination. Recent, research that has been done on sort of large survey levels have showed that pediatricians are one of the most trusted sources of information about vaccinations. And, upwards of 35 to 50% of parents have reported that pediatricians are who that they would trust the most. Similarly, we're seeing this in national surveys with adults saying that their own doctors who they would trust the most, or their child's pediatrician. And you can see this graph on the right, those first two lines, the darker blue on the left and the middle show a great deal or a fair amount. So we're seeing, 70–80% of parents saying that they trust pediatricians a great deal or a fair amount for information on vaccines. So that's all to say that we know that pediatricians and other people in the office are very important touch points. And so we've really designed our strategy around taking advantage of this relationship and tailoring existing evidence-based strategies to have these conversations about seasonal vaccines. So most importantly, we're drawing on the work that shows that pediatricians really are the most trusted source. We know that parental intentions around these two vaccines are low, and we are adapting what has worked for other adolescent vaccines. We have drawn a lot from best practices around talking about the HPV vaccine, which often also we know has some challenges in parental acceptance. And across the board, our approach, and I'm going to sort of go through an overview of what our recommendation approach is intended to really encourage hesitant parents. We think about these people as sort of the movable middle. We might be able to get those parents to become more accepting of vaccines and simultaneously not alienate the really resistant parents and really work to be collaborative in this decision making. So this is, we call it sort of our algorithm, but that might even be too fancy of a word for this, but this is our sort of decision tree around recommending these seasonal vaccines, and I would say for really any vaccine. So our goal is to start with a strong recommendation. I'll talk a little bit about that in a minute. And so it's really three components. I'll back up. It is to give a strong recommendation, to work in your personal vaccine story in that conversation, and then to bring in principles from motivational interviewing to assess whether parents are hesitant or resistant and use slightly different tailored strategies depending on that, while simultaneously honoring parents' autonomy throughout the whole visit and recognizing that persistence is critical and that this is likely something you're going to need to discuss for especially the more hesitant parents, discussing it every visit. So starting with a strong recommendation, this is, increasingly, I think, best practice for all vaccines. There is an enormous amount of data on the effectiveness of using a strong recommendation when talking about HPV vaccination. And we are starting to see pretty strong quantitative research come out that emphasizes that it is also the best approach for COVID-19 and other vaccines. And so what this recommendation might look like in this case is, something along the lines of, I'm committed to keeping your child as safe as possible from COVID-19 and influenza infection this season, so I strongly recommend that we do these vaccines as soon as possible. The three key features of a quality recommendation are to emphasize the importance of the vaccine, so tying it to, keeping a child healthy and emphasizing how critical that is, making it timely. Ideally, you would recommend to receive these vaccines at every visit. If you're vaccinating in clinic for both of these, you can say that we can do them that day. We are providing some information on where parents can get COVID-19 and influenza vaccines. We're sort of at the tail end of flu season, but where parents can get COVID-19 vaccines around your clinic. So if you're not able to do the vaccine in clinic today, you can recommend them, very easy locations. And then finally, we want to make sure that recommendations are consistent. So we want to make sure that we are routinely recommending these vaccines to all of our patients. The second key feature of our recommendation approach is integrating your personal narrative for vaccination. This is really strongly drawn from what we have heard again and again from parents and what we have been hearing certainly in the literature as well. And so we have given some examples of these sort of personal narratives, and many of you in the office participated in our poster campaign, which will be sort of out soon. And it's really about tying tying these vaccines to something more than just saying, I trust these vaccines and they work. It's really showing sort of your own personal trust in them. So whether that's, assuring patients that you got your own children vaccinated, whether it's, integrating something along the lines of the second one. I've seen a lot of my patients get really sick every winter, and some even end up in the hospital. One of the easiest ways to protect yourself is to get seasonal vaccines. So I recommend them to all my patients, and I always get them myself. So again, especially when talking to parents, for example, I don't have kids. So, when I have done this exercise in other groups, I talk about how I feel it's so important for all of our, parents and young people to get it. And, I always, check with my sister about whether my nephew has been vaccinated. So really just trying to tie in some sort of personal relationship. And then finally, we get into assessing hesitancy versus resistance. So this can happen sort of after the recommendation occurs, but at some point, you may choose to save your personal story until you really get into this conversation. But once you've made the recommendation, transitioning to asking an open-ended question to assess parents' intentions, like, what are your thoughts on getting your child these vaccines today? And then we will sort of move into the motivational interviewing piece of this, depending on how a parent answers these questions. Obviously, in a sort of perfect world, they would say, "Great, let's do it today, no problem." But there will probably also be a lot of scenarios where you encounter a parent wanting to have more of a discussion or express more resistance. And so this is really where we get into motivational interviewing. And I would like to note, as we get into this section, that this is not a full motivational interviewing training. Motivational interviewing is a complex conversation style, and I'm guessing many of you have done MI trainings in the past. Certainly you could do a whole, 1 hour session or multiple hour sessions on motivational interviewing. We are using it in this case to sort of pull some best practices and develop tailored approaches. So just as a caveat, we are not suggesting having full MI length conversations, which often are very time consuming, but rather we are talking about how we can pull some best practices from motivational interviewing to discuss vaccination. So briefly, if you're not familiar, motivational interviewing is a directive, person-centered methodology for communicating and counseling that aims to elicit and strengthen motivation by helping people explore their own ambivalence around an issue. There is a lot of great work on motivational interviewing around things like smoking cessation and dietary change, and we think there's a lot of literature that exists around using motivational interviewing for vaccination, sort of drawing out these best practices. So my colleague, who is not able to co-present with me today, but some of these slides are hers, and I have heard her give this presentation before and talk about how motivational interviewing is like a dance, not a wrestling match. You're really trying to work with the parent and be collaborative rather than, having it be more of a contentious conversation. And that's really the goal, is collaboration, not contention. Within motivational interviewing, the primary goals that we are trying to focus on are exploring and resolving ambivalence, and really trying to create and amplify from that parent's perspective a discrepancy between their present behavior and his or her broader goals and values. So at the beginning of this presentation, I spoke a little bit about how in the national data, we are seeing that a very high percentage of parents are not willing to get the COVID-19 vaccine for their child, but we are simultaneously seeing a very high percentage of parents who are worried about negative health effects from things like COVID and influenza and RSV. So it's talking about creating those kinds of discrepancies in parents' behavior and their goals. The goal is to minimize resistance. So trying to, move a parent from, along that spectrum of vaccine hesitancy away from resistance. Eliciting change talk, that's to say, to get the parent to sort of say out loud what might motivate them to change or what might they need to hear to become more vaccine acceptant. And at the heart of it, to sort of nurture hope and confidence for the future, to leave that encounter, whether the parent accepts vaccination or not, feeling very positive. The rule is sort of the guiding principles of motivational interviewing. And again, I'm not going to get too deep into this, but I'll sort of briefly go through each one. So as we're having these conversations, some of the key features to sort of keep in mind and remember are around resisting the writing reflex. So resisting that language around, after a parent says, I really, I'm not going to get those vaccines today. Resisting that urge to say things like, I really think you should, or you really need to do this for your child. And taking a step back to really understand parents' motivations, and express interest and sort of question around their concerns and values, and help to explore their current perception about their situation and their motivation for vaccination. This might look like something along the lines of asking open-ended questions to really try and figure out why they might want to or not want to vaccinate their child. And that is then listening with, presence, acceptance, and curiosity. And again, when my colleague says this, she really emphasizes that this is a key feature of, not just asking parents questions, but sort of waiting and listening to their answers. And, ending the conversation by really empowering families by acknowledging that it is their choice and rolling with resistance, which we will talk about in a few slides. But I'm actually at this point going to share our role-playing videos, which I think are sort of the best way to highlight how these kinds of conversations could play out in real life scenarios. So we have two scenarios, one for a hesitant parent and one for a more resistant parent. So I'm going to go ahead and play those and then give some more details after that.
Okay, that sounds great. And before we wrap up, I'd like to talk a little bit about the COVID-19 vaccine. I see Ezra hasn't been vaccinated against COVID, and our office strongly recommends that our patients do get vaccinated against COVID to protect them and their families. In fact, we can give Ezra the vaccine here in clinic today. What are your thoughts on getting your child vaccinated today?
Honestly, I'm not sure yet. We just haven't decided yet.
I want you to know that many parents feel the exact same way as you do, and their reasons for being undecided vary widely. Would you mind sharing with me what's on your mind about getting the vaccine?
Well, I'm just a little nervous. The vaccine is so new and we don't know how it's gonna affect the kids in long term. Everyone's saying that it was made too fast and we just don't know what's gonna happen to kids who get it like 10 years from now. But I also wanna keep my kids safe. I heard on the news that some kids get sick from COVID and maybe even end up in the hospital. I don't know. I'm just really conflicted about this.
I can understand your conflict. On the one hand, you feel like there's not enough information out there about the long-term effects of the vaccine. And on the other hand, you want to keep your child safe here and now, which the vaccine would do. Would it be okay with you if I shared some information about what we do know about the vaccine and see if I can address some of your concerns?
Yeah, sure.
Great, thank you. So scientists have been doing research on the development of vaccines for a long time, even before the pandemic started, including the vaccine that we're using against COVID. And it may seem like the COVID vaccine was developed quickly, but it's actually taken scientists over 10 years to develop this specific type of vaccine. And the COVID-19 vaccine was tested and approved by the FDA in the same way that all other vaccines have been tested. And you had some concerns about some of the long-term effects of the COVID vaccine, and I'd like to address some of those if you don't mind. We know from other vaccine research that when side effects do happen, they usually happen shortly after the vaccine is administered and not years later. And this is why we hold on to children 15 to 20 minutes after the vaccine is administered to monitor them for side effects. And what we're finding is the most common side effect is some local redness and irritation at the injection site that actually goes away with time. What are your thoughts about this information?
Well, it's good to hear this information coming from a doctor. There's so much information on the internet saying that the vaccine hasn't been tested at all and that no one even knows the long-term effects.
It can be hard to make a decision when you're getting information from so many different resources, including the internet. And I want to be there to help and support you in any way that I can. And ultimately, whether you vaccinate your children or not is your decision. I do want to share with you that I did get my child vaccinated as soon as it was available. I've also seen many kids get very sick with COVID infection and some even require hospitalization. And all that to say is our role as a physician is to just educate families as much as we can about the COVID-19 vaccine so that you can make the best and safest decision for your child, and your family.
That's reassuring to hear. I feel more confident about vaccinated Ezra after learning about side effects happening right away. And that you also had your kids vaccinated. But I do have to discuss this.
Of course, you are not alone in this, and please feel free to call the office with any questions or concerns that you may have. I want to give you this pamphlet with facts about the COVID-19 vaccine. There's also a list of local clinics, walk-in clinics that you can go in and get Ezra vaccinated without needing an appointment, so you won't even have to necessarily come back to clinic. I'll also follow up with you at our next appointment about the vaccine.
Thank you.
Okay, I'm not gonna sort of discuss each one, but we'll go into this next scenario around a more resistant parent.
That looks great. And before we wrap up, I'd like to talk a little bit about the COVID-19 vaccine. I see Ezra hasn't been vaccinated against COVID, and our office strongly recommends that our patients do get vaccinated against COVID to protect them and their families. In fact, we can give Ezra the vaccine here in clinic today. What are your thoughts on getting your child vaccinated today?
No, absolutely not. I am not getting my kid vaccinated.
Okay. I want you to know first and foremost that this is your decision, and I respect that. And parents have all different reasons for vaccinating and not vaccinating their children. Would you be able to share with me what are some of your concerns about vaccinating Ezra?
I just don't think that kids can really get sick from COVID, and from what I've seen, the vaccines give them all types of heart problems. I just don't want that to happen to my child.
Okay, I want to just make sure I understand your concerns. I think I heard you say that you're not that worried about the risk of COVID in your children, but you are concerned about some of the risks and side effects associated with the COVID-19 vaccine. Is that right? Would you be able to tell me a little bit more about that?
Yeah, well, COVID isn't as a big deal as everyone makes it seem. I know tons of people who've gotten it and they say it's just like a cold. I'm sure you think I don't care about my kids, but I just want them to be healthy. And from what I hear, the vaccine is making them sick.
Okay, I want to reassure you that I acknowledge and understand how much you love your children and how much you want to protect them. And I want to do the same. I hear you saying how much you want to protect Ezra, but you fear that the COVID-19 vaccine may actually be harmful to him. Does that sum up how you're feeling?
Yeah, pretty much.
So we've heard very similar concerns from other parents, and as a parent myself, I can understand that this is a very challenging decision to make. There are actually many pediatricians in this office who took some time to vaccinate their children until they felt that they understood the vaccine enough, and they eventually did it. It's understandable that you want to think through this decision carefully. If you would allow me to ask you a related question, if you were to vaccinate Ezra in the future, what might your reasons be?
I guess I really want to know that it worked to keep my kids safe. And that there wouldn't be any major side effects. And that I wouldn't get them sick.
I hear you. On the one hand, you're not so sure that a COVID infection would make Ezra really sick, but you're concerned that the vaccine could affect his heart. And on the other hand, you might consider the vaccine if you had reassurance that it would protect Ezra. Would it be okay with you if I shared some information about what we do know about the vaccine?
Sure.
You're right that some kids do have side effects from the vaccine, and most of these are very mild. The most common mild side effect that we're seeing is some local redness and irritation at the injection site that goes away shortly after the injection. In rarer cases, we are seeing some severe adverse effects of the COVID-19 vaccine, including myocarditis, which is very rare. In one study that included 8 million vaccinated children, only 11 were diagnosed with myocarditis, making it exceedingly rare. You're also right that the COVID-19 vaccine doesn't prevent us from contracting the virus, but it does prevent us from getting severely sick and can prevent us from getting hospitalized. And that's the number one reason why I got my own child vaccinated. All this to say that I respect any decision that you end up making. Does all of that make sense? And do you have any further thoughts or concerns about any of the information that I've shared with you today?
No, not right now.
If you want to talk about this further, you can always feel free to call the office at a later time. And I want to give you this pamphlet with information about the COVID-19 vaccine, and it has other resources in there that we trust. And I'll make sure to circle back with you about the COVID-19 vaccine at our next visit.
Thanks.
Okay. So, we made these videos as part of this project, in March 2021. So some of the language you hear is probably more reflective of what our knowledge around COVID was and sort of how we were having those conversations, at that time. Obviously, things have changed a little bit, but the sort of key principles of these videos, remain the same. And so I want to spend a few minutes highlighting some of the specific strategies that we suggest, drawing from motivational interviewing to really focus on differences between hesitant and resistant parents. So again, understanding hesitancy versus resistance is maybe more of a feeling, and sort of when you ask that question of, can you tell me where you're at with deciding to vaccinate your child today, or however you decide to ask that open-ended question, that's probably going to give you some insight into sort of where on the scale a parent falls. But regardless of where, all of these conversations, start by setting the stage by asking permission, reinforcing parental autonomy, and really using open-ended questions to explore parents' motivations. So some of the things around hesitant parents that we wanted to really highlight were really focusing on exploring that ambivalence and pointing to potentially discrepant motivations. So parents who, I think in this example video, the parent said something along the lines of, I want to keep my child healthy, but I'm worried that the vaccine might make him sick. And so using that as an opportunity to sort of point out potentially some of the reasons, that for vaccinating versus worrying about the vaccine making them sick. This is also an opportunity to correct misinformation. We are still seeing widespread misinformation about COVID and many other vaccines right now. And so once you've sort of been able to explore with parents what their motivations are, some of that misinformation might come out, and this gives you the opportunity to ask them, if it's okay to share some other information with them and correct some of that. The other thing that we really want to do with hesitant parents is around eliciting change talk. And we saw some examples of that in the video. Another great tool that I think is very helpful in sort of getting a parent to express some of this out loud is to ask the question, okay, on a scale of 1 to 10, where would you fall in terms of vaccinating your child? And if that parent says anything other than, essentially a 0 or a 1, you can then sort of use that as a follow-up to say, well, could you tell me why you said you're at maybe a 2 and not a 1? And try to get them to say back to you maybe what some of their potential positives around vaccination are. For more resistant parents, the goal would be to move them certainly closer to that more hesitant, movable middle category, and then ultimately towards more acceptant. But this might take time. And so similar to hesitant parents, you really want to explore that resistance and identify whether there are even the potential motivations for change there right now. And some of the strategies that we use for that are using reflective listening. So things like, in the video, I think the example was, so let me, I hear what you're saying. Can I think what you're saying is A, B, and C. Does that sound right? And sort of repeating back to the parent what you're hearing and summarizing it for them. Emphasizing their personal choice, which again, in the video, I think came across very strongly. This is your decision and your decision for what's best for you and your family. And then if there is any of that ambivalence, similar to reflective listening, trying to capture and reflect back that ambivalence to the parent. In some conversations, you might find more of an in with this than others. Saying things like, I really just want to protect my child. I think that in the video, the pediatrician sort of reflected that back and said, that's really what I want to. We are both working towards the same goal. How can we discuss this more? So there are, I would say minor, but I think important differences between how you would approach hesitant versus resistant parents. With hesitant parents specifically, you might push a little bit more and ask more around correcting misinformation and trying to elicit this change talk. With resistant parents, it's really using these roll with resistance strategies to emphasize autonomy or personal choice, and hopefully try and capture somewhere in that conversation a little bit of that parent's ambivalence to try and sort of push on that a bit. So these are just some suggestions for using motivational interviewing strategies and language. I think likely these are all things that you're using in your practice anyway, so I'm not going to go through all of them, but just if you're reviewing the slides or looking at these later, we've included some sample language around empathy and collaboration. I think especially affirming parents' concerns. There's a lot of power in, saying, you're right, we actually hear that from a lot of parents, and you're not the only one that we're hearing these concerns from. Can I talk to you about, can I talk to you about some of your concerns, and can we talk through those? Eliciting change talk, and finally respecting parents' autonomy. So just to recap, we started by giving a strong and presumptive recommendation at every encounter with parents of children who are not up to date on these vaccines. Working in your personal story at some point in this conversation, and the videos gave a great example of that. Assessing whether that parent is more hesitant or resistant, and using some different strategies for talking with them depending on that. And in all encounters, honoring parents' autonomy and sort of at a practice level, recognizing the need to be persistent in these conversations and to really use every visit as an opportunity to discuss these vaccines. So just briefly to give you some idea of sort of what this overall project is beyond this webinar, we've also created some posters that feature a lot of your staff sharing their personal vaccine stories that will be up around the clinic. We've created a one-pager that will be distributed, as well as a list of local vaccine clinics. So all materials that you can use to support these conversations. And we have created all of these sort of based on prior projects and based on a lot of what we heard directly from parents. So for example, this FAQ about seasonal vaccines, we drew a lot of this from what we've heard in focus groups directly around what parents' concerns are. And we've used language that, we have worked to make very accessible to parents. As a follow-up to this, because this is a sort of clinical trial, we have clinics enrolled across the state that we're doing this project in. We'll be doing the post-intervention parent exit surveys towards the end of this month into March. And we'll do just some very brief check-in interviews post-intervention. I hesitate to even call them interviews. These will be brief phone calls that we'll conduct with people on your team just to hear about, what you thought of some of these materials and what your continued challenges around vaccination are. I'll be following up with a Google Forms poll that just asks some questions about the webinar today. And then finally, please feel free to reach out to me. I've left my email address here, and Esther certainly has my email address. But if you have any questions about this, or do want to talk further, or want to schedule time for an in-person training, I'm happy to meet with your team at other points. So that wraps up what I have for today. Thank you so much for participating, and to your clinic for working with us on this. We are very excited about this project, and we appreciate the time that you're spending on it. Thank you.